So we will be moving to the next 40th page. चरग ने पृष्ठ मृत्तिका का वर्णन किया है. So Charaga has mentioned Brishta Mrittika. Okay, under which Gana? Purisha Virajaniya Mahakashaya. In that Mahakashaya Gana, Brishta Mrittika is included. Like Charaga has mentioned 50 Mahakashayas are there. Okay, so in that one Kashaya is Purisha Virajaniya Mahakashaya. In that one of the drug is Brishta Mrittika. So Purisha Virajaniya means it is giving color to the fecal matter. Okay, so the herbs which is helps in the giving color to the fecal matter, that comes under the category of Purisha Virajaniya Mahakashaya. So in that one of the drug is Brishta Mrittika. Okay, next. Jambu Patra, Amra Pallava, Laja, Mrittika, Anar. This also has included in Chardi Nigrahana Mahakashaya. For reducing the vomiting, in that category, these drugs are included. Okay, Chardi Nigrahana Mahakashaya, in that Jambu Patra, Amra Pallava, Laja, Mrittika, Anar. These are all indicated. Okay, these are all included in Chardi Nigrahana Mahakashaya. Next one is Gairika va Mrittika ke Kapalaka Varnana Shonida Stabana Mahakashaya. Okay, so in Shonida Stabana Mahakashaya, like the drugs which helps to arrest the bleeding. In that category, Gairika, Mrittika, these are all included. Next one is अशोक का वर्णन वेदना स्थापना महाकषाय में मिलता है ना कि शोणित स्थापना में. Ashoga, okay, so the drug that is usually given for arresting the bleeding. Okay, so it helps to stop the bleeding, this Ashoka drug, but it is included under Vedana Stabana Mahakashaya. So that type of tricky questions you can get. So Ashoka, it is basically used for stopping the bleeding. For that kind of condition we used to give Ashoka. But Charaga has included Ashoka in Vedana Stabana Mahakashaya. So sometimes you can get question, it comes under which Mahakashaya. So but practically we used to give for giving the bleeding disorder. So we will go for the Shonida Stabana. So that's why it is not included in Shonida Stabana. It is included in Vedana Stabana Mahakashaya. Okay, in the same way Arjuna का वर्णन उदर्द प्रशमन महाकषाय में है, हृदय महाकषाय में नहीं है. Arjuna, that is good for the heart disorders, but it is not included in Hridya Mahakashaya, but he has mentioned under Udarda Prashamana Mahakashaya. Okay, Udarda we can correlate with the urticaria type of condition, skin lesion. In that condition, this Arjuna is indicated. Okay, so this type of things are very important. Brishta Mrittika is included in Purisha Virajaniya Kashaya. Gairika Mrittika, it is included in Shonida Stabana. Ashoka, it is indicated in Vedana Stabana. Arjuna is indicated in or it is included in Udarda Prashamana Kashaya. Next one is Karnakshveda Lakshana. Okay, so in Karnakshveda, that we can correlate with the tinnitus condition. There is a ringing sound will be hearing. Okay, so Susruta is telling Atikshveda, there is excessive sound you can hear in the ear, that is called Karnakshveda. So how we can tell means Venu Ghoshopama Svana, like Venu Nada, flute sound if you are hearing. Okay, so in the ear if you are hearing flute sound, that is called Karnakshveda. And the disorders happen because of the Vada Pitta vitiated. Okay, due to the Vada Pitta vitiation, you are hearing Venu Nada Shabda, that is called Karnakshveda. Okay, Karna Nada, that is also similar to tinnitus only. So this Karna Nada is happening because of the Dadukshaya you are getting. Okay, because of the Dadukshaya you are getting. So here also Shrinodi Shabdan Vividan. So you will be hearing different type of sound you can hear. Okay, in Karnakshveda, excessive ringing sound, which means like a Venu Nada, like Venu Nada sound will be hearing. In Karna Nada, different sound in different frequencies you will be hearing. That is the difference. Okay, in Karnakshveda, hissing type of one type sound only you can hear. Karnanada, different sound, different frequencies you can hear. Srinodi, Shabdan, Vividan. So which are the different sound? Bheri, Mridanga, Shankha. This type of instrument sound you can hear in the ear, that is called Karnanada. That is a Vada predominant condition. So the instrument name they can ask. Okay, so Venu Nada Shabda you will be hearing in Karnakshveda, and the dosha predominance is Vada Pitta. Bheri Mridanga Shanga, this type of sound you will be hearing in Karna Nada, and the dosha vitiation is Vada dosha. So, okay. So these are the two conditions. Next one is some lakshanas related with the 5 types of hika. Sarva Gatra Prakampani, like full body is getting tremor, that you can see in the Mahahika. Vipludaksha Lakshana. Vipludaksha means the eye will be moving like different side. Okay, so that you can see in Vyapeda Hika. Sadhya Pranahara Mada, immediate death will be causing in Mahahika. Pranantiki Mada, that is also the patient will be die. So that quotation Pranantiki, so that term is mentioned under Gambhira Hika. Prana Uparodini, which means it obstructs the Pranavaha Srodhas and patient will die. So that also you can see in Vyapeda Hika. So the Prana Uparodini term is comes under Vyapeda Hika. Pranantiki term is comes under Gambhira. Sadhya Pranahara that comes under Mahahika. Okay, so these terms are important. So it comes under which type of hika they can ask. Next one is Kapoda Eva Kujana. So this lakshana you can see in Apatandraka condition. Okay, then Paravativa Kujana you can see in Kshadaja Kasa. Okay, Kapoda, Parava, these are all indicating pigeon. Okay, so that term, like based on the term they can ask. So Kapoda Iva Kujana, so that type of context is mentioned under Apatandraka. Parava Iva Kujana is mentioned under Kshadaja Kasa. Next one is Samsarjana Krama. Like after the Shodhana Karma, we will be doing Samsarjana Krama. So what is the order of Samsarjana Krama? First one Peya, next Vilebi, then Akrida Yusha, Krida Yusha, Akrida Mamsarasa, Krida Mamsarasa. Okay, this is the order. So first of all Peya, then after that you have to take Vilebi, then Akrida Yusha. Akrida Yusha means like a you will be preparing Yusha without adding this spices. Okay, without adding sneha, without adding spices like a pepper powder. Okay, the seasoning things are there, no? So if you are not using that type of ingredients and only yusha if you are preparing, that is called akrita yusha. Krita yusha means you are adding sneha, you are adding spices, and with that if you are preparing yusha, that is krita yusha. So first of all akrita yusha, then after that you have to give krita yusha. The same thing, akrita mamsarasa, you are preparing mamsarasa without adding sneha and spices, so that is akrita mamsarasa. By adding the spices it is called as krita mamsarasa. So this is the order of samsarjana krama. Then based on the rasa how we have to give. So first of all starting with the snigdha amla madhura rasa, then amla lavana, then madhura tikta, then kashaya kadu. This is the order of rasa should be taken in samsarjana krama. Next one is 3 types of basti: karma basti, kala basti, yoga basti. Very very important, they can ask you the numbers. Okay, so karma basti is total 30 bastis are there, kala basti total 16, yoga basti total 8 basti. Okay, so in that karma basti 30 bastis are there. So the first one will be starting with anuvasana, then anuvasana niruha, like that alternatively you have to do it. So first one anuvasana, then 12 anuvasana, 12 niruha, like that alternatively you have to give anuvasana and niruha. Then the last 5 will be only anuvasana. Okay, so first day anuvasana and the second day also anuvasana, third day niruha, then fourth day anuvasana, then fifth day niruha, like that. First day anuvasana, then second day onwards anuvasana, niruha, alternatively you have to give. So total 12 anuvasana, 12 niruha, alternatively you will be giving, and the last 5 days only anuvasana. So total will be coming 30 basti. Kala basti 16 kala bastis are there. So first it will be starting with anuvasana, then second day onwards 6 anuvasana, 6 niruha, alternatively will be giving, then last 3 days only anuvasana. Then yoga basti 8 in number. So the first day anuvasana, and then second day onwards 3 anuvasana, 3 niruha, alternatively will be giving, and the last one day anuvasana basti will be giving. So like that 8 basti will be coming. So karma kala yoga basti numbers are very important. Okay, so 30 is karma basti, 16 is kala basti, yoga basti, total 8 bastis are there. Next one is Mahamarma. Mahamarma is Hridaya Basti Nabhi is Mahamarma, and Trimarma is Hridaya Basti Shiras is also there. Okay, Hridaya Basti Shiras is called as Trimarma. Next one, Niruha Basti dosage they are mentioned, like how much quantity you have to take each Kwada, Kalka, Saindava, all those things, but that is not much important. Okay, for depends upon the Vada, Pitta, Kafaja, Dosha condition, how much Saindava, how much Madhu we have to add in the Niruha Basti. So that is not important for us. So the next one is निरूह की मात्रा अनुवासन से 4 गुना होती है in humans. Okay, मनुष्य में. So in humans, the amount of niruha is 4 times that of anuvasana matra. Okay, how much you are taking anuvasana? From that, 4 times you have to take niruha for human beings. Okay, niruha की मात्रा अनुवासन से 8 गुना होती है जानवरों में. So in animals, the amount of niruha is 8 times that of the anuvasana. Okay, for humans it is 4 times, for animals it is 8 times. Then niruha basti sankhya for vada dosha 1 niruha basti, for pitta dosha 2, for kapha dosha 3 niruha basti. Then niruha basti nirmana krama, how the order of the preparation of niruha basti. First of all, madhu and saindava, that you have to mix it. Then after that sneha should be added, then kalka, then kwada. This is the order of preparation of niruha basti. Then pashuo mein basti krama, so it is a order of basti in animals, that is not needed. Okay, then mahadoshagara bhava sankhya is 8 in number. Then shiro virejana dosage. Okay, for uttama dosha 3 times you have to give shiro virejana, for madhyama dosha 2 times, for hina dosha 1 times you have to do shiro virejana. Then pradimashanasya dosage is 2 bindu, very very important. Okay, pradimashanasya dosage is 2 bindu. Marshanasya dosage for tarpana 10 bindu, for madhyama 8 bindu, for hina 6 bindu. This is the dosage of marshanasya. Next one is that usage of the shastra karma. Okay, mandalagra karapatra shastra, that is used for the chedana lekhana karma. Vriddhipatra nakashastra mudriga ulpala patra ardhadara, that is used for chedana bhedana. Kutariga vrihi mukha ara vedasa patra is used for vedhana karma. Bedisha dandashangu is used for aharana karma. Eshani is used for anulomana karma. Then remaining shastras are used for the visravana karma. Okay, so total 20 shastras are there. So in that the rest of the shastras will be used for visravana karma. Then shastra dhara pramana. Okay, the dhara pramana means to increase the sharpness. Okay, the sharpness of the shastra. So for chedana ardha kaishigi, that much matra should be there. Okay, chedana, if ardha kaishigi, that much shastradhara is there, then that is used for chedana karma. For vedana visravana karma kaishigi, for lekhana karma ardha masuri, then bhedana masuri. This is also important. Okay, very very important. So shastra dhara pramana, for ardha kaishigi, that much pramana is there, that is used for chedana karma. Kaishigi is used for vedana visravana karma. Ardha masuri, that is used for lekhana. Masuri is used for bhedana karma. Next one is length of the shastra. Mudrika shastra, the length of the mudrika shastra is tarjani ke agrima parva ke barabar, like terminal phalanx of the finger. Okay, terminal phalanx, so that much size is mudrika shastra. Then naka shastra eshani, length is 8 angula, sharari mukha is 10 angula, and the remaining shastras are 6 angula is the length of the shastra. Then we have seen upayandra, anushastra, like that we have seen, no? So in upayandra, anushastra, some instruments are very commonly you can see. Bala, nakha, kshara, agni, anguli. Okay, bala, nakha, kshara, agni, anguli. These instruments you can see in upayandra also, anushastra also. Okay, so you can get a question, bala comes under which category? So upayandra, anushastra will be there, and another option both A and B, like that option you can get. So that you have to study bala, nakha, kshara, agni, anguli, these are all comes under both upayandra and anushastra. Then shastra anushastra sreshta, that is kshara karma. So kshara karma is sreshta among shastra and anushastra. Then anushastra mein sreshta is jaloga, that is according to Charaga. Charaga is telling in the anushastra category jaloga is the best variety. Then for doing rakta mokshana, 4 type of instruments are there: sringa, alabu, jaloga. Okay, one more is also there. Fourth one is siravyada. Okay, sringa, alabu, jaloga, siravyada. So these are the instruments which will be used for the rakta mokshana. So sringa is used for the vadaja dushti, for vada vitiated rakta. In that case, sringa has to be using. So the sringa, from the sringa, 10 angula, that much we can withdraw the blood. Okay, that much blood we can draw 10 angula. The length of the shringa is 18 angula, width of the shringa is 3 angula, and the hole, okay, the hole which is similar to sarshapava chidra. Okay, the hole which is in the shringa, okay, so that hole will enter the sarshapa. Okay, that much size, sarshapa size, that much size to the hole you can see in the shringa. Shringa we can correlate with the horn, HORN, horn. Okay, so the size of the hole should be sarshapa size. Length is 18 angula, 3 angula width, and how much blood we can withdraw from the shringa, that is 10 angula. Then alabu. Okay, so alabu, it is used for the kafaja dushti. So the how much rekta we can use it, like 12 angula. Okay, 12 angula blood we can suck it out by using alabu. Length of the alabu is 12 angula, width is 18 angula. Okay, so alabu we can correlate with the cupping therapy. Okay, so in that way. So 12 angula rekta we can draw. Then length is 12 angula, 18 angula width. Then jaloga, that is used for the pittaja dushti. Okay, so pittaja dushti, in that case you can use jaloga. From jaloga you can take ek hasta parimana. Okay, 1 hasta. That much blood we can withdraw from the rekta mokshana from the jaloga. Okay. Then the last one is Siraveda. Siraveda is indicated in the dosha which is spreaded all over the body. Okay, dosha has spreaded all over the body. In that condition you should do Siraveda. Okay, so like they will be telling for Vadaja Dushti which one we have to use for Sarvadosha Pragopa, or the dosha which has spreaded all over the body, so which procedure. So that is Siraveda. For Vadaja Dushti Shringa, for Pittaja Dushti Jaloga, for Kafaja Dushti Alabu. Next one is Anga Ulpati, how the organs are forming. Okay, so Yakrit and Pliha which is formed from the Rekta. Okay, Yakrit and Pliha which is formed from the Rekta. Fupfusa which is formed from the Rekta Fena. And Unduga which is formed from the Rekta Kitta. Then Vrishana which is formed from the Mamsa, Meda, Kapha, Rekta. These are all getting combining together, you are getting Vrishana. Mamsa, Meda, Kapha, Rekta. And Meda and Rekta join together, you will be getting Vrikka. Then Apara, placenta. Okay, that is formed from the Artava. Okay, Apara is formed from Artava. Jihva, that is formed from Mamsa, Rekta, Kapha. Okay, Mamsa, Rekta, Kapha, these join together, you will be getting Jihva. Then Peshi, that is formed from the Pitta Yukta Vayuva Mamsase. The Mamsa is getting divided by the action of the Pitta Yukta Vayu. Okay, Pitta and Vayu, these two togetherly will enter into the Mamsa and they will try to divide it. So by that way Peshi will be obtaining. Then Hridaya will be formed from the Shonida and Kapha. These two togetherly forming Hridaya. Then Andhra, Guda, Basti, this will be forming from the Tridosha mixed with the Rekta. Andhra, Guda, Basti, these are all formed from Tridosha plus Rekta. So this Anga Ulpati is very, very important. So usually Vrikka, Hridaya, okay, Yakrit and Pliha, these are all most of the question papers you can see from where it is originated, the question used to get. Next one is Ashras. Okay, according to Sushruta, this Vadaja Ashras will be looking like similarities they are telling. So Vadaja Ashras is similar to Kadamba Pushpa, Tundikeri, Nati Mugala, Suji Mukhagradani. Okay, so in these shapes if you are finding the Ashras, that is Vadaja Ashras. Pittaja Ashras is Yakrit Prakashini. It will be looking like a liver, the liver color, Yakrit, the color of the Yakrit is there. No? In that way, that color Ashras if you are getting, that is Pittaja Ashras. Shuga Jihva Samsthani, it will be looking like a Shuga Jihva. Then Yava Madhyani, Jaloga Vakra Sadrishyani. So Yava, barley. Okay, the middle portion of the barley, how it will be, in that way Ashras is there. Then Jaloga Vakra Sadrishyani, the mouth of the Jaloga. Okay, in that shape if you are getting Ashras, that is called Pitta Ashras. Then Sleshma Ashras, it will be looking like Karira Panasasti and Gosthana Agara. In this shape if you are getting Ashras, that is Kafaja Ashras. Rekta Ashras will be looking like Negrodha Praroha, then Vidruma, Kakanandika Phala Sadrishyana. These are the shape for Rektaja Ashras. Okay, so the shape of the Ashras, based on that we can tell that which type of Ashras patient is having. Next one is Chigilsa for Arshas. Aushada Sadhya Arshas are Navina Alpa Dosha Yukta. So the new acute Arshas, and it is only mild doshas are vitiated, then we can treat that condition with the Aushada medicine. Mridu and Prasruta Arshas we can treat with the Kshara Karma. Karkasha Stira Prudu. Okay, little bit hardness are there and a little bit deeply situated, then you can go for Agni Karma. Tanu Mula Uchradani Kleda Yukta, that you have to treat with the Shastra Karma. So in Arshas, 4 type of treatments we can do: Aushada, Shastra, Kshara, Agni. So Aushada is indicated in new condition with the mild dosha. Mridu Arshas we can treat with the Kshara Karma. Karkasha Stira Prudu we can treat with the Agni. Okay, then Tanu Mula, very mild root is there, okay, and it is elevated, then you can treat with the Shastra Karma. Okay, then Shalaka Yandra and its functions. Okay, 20 types of Shalaka Yandras are there. So in that different type of Shalaka Yandra you can see here. Gandupada Mukha Yandra, that is two types are there. It is used for Eshana Karma. Sarpafana Mukha Yandra, 2 types are there, used for Vyuhana Karma. Sharapunga Mukha, it is 2 types, used for Chalana Karma. Bedisha Mukha Yandra is 2 types, used for Aharana Karma. Karpasa Krudoshnisha, that is 6 types are there, used for the Vrana Paunchine. For the cleaning the wound, we can use Karpasa Kradoshnisha Yandra. Next one is Masura Dala. Okay, Masura Dala Agridi Yandra is there, that is used for the Srodogada Shalya Nirharana. Darvya Agridi Yandra, that is 3 types are there, that is used for the Kshara Karma Aushada Pranidhana. For Kshara Karma you can use it, and for putting the Aushada, for dusting the Aushadas you can use Darvya Agridi Yandra. Then Jambavoshta Angusha Mukha, both are 3 are there. Okay, Jambavoshta Yandra 3, Angusha Mukha Yandra 3, both are used for the Agni Karma. Kolasti Dala Yandra is that is one variety used for Nasarbuddha Haranartha. Then Kalaya Parimandala Yandra, that is 1 type for using for Anjana. Maladi Pushpa Vrindagra, that is 1 type used for Mutra Marga Vishodhanartha. Okay, so these are the functions of the each yantra. Then how to hold the shastra. Okay, shastra ko pakatne ka sthan, how to hold, like from where you have to hold the shastras. So Bhedana Shastra. Okay, so Bhedana Shastra you have to hold between Phala and Vrinda. Okay, where the Phala and Vrinda is joining. So in that particular area you have to hold the Bhedana Shastra. Okay, then Visravana. Okay, for the Visravana, Vrindagra se pakade. So you have to hold the Shastra in Vrindagra, the tip of the Shastra. There you have to hold the instrument for using for the Visravana. Okay, if the instrument which is used for the Visravana, you should hold in the Vrindagra, the tip of that circle you have to hold it. Then Yeshani Ara Karapatra Shastra. These are all how to hold it. Mool se pakade. So the root area you have to hold it. Okay, so in the root area you have to hold these Shastras. Okay. So not much important. Rest of the before that Yandra, this is important. Shalaka Yandra, that functions they can ask. Next one is Jaloga. Jaloga basically divided into 2 types: Savisha Jaloga, Nirvisha Jaloga. Savisha Jaloga 6 types are there. Nirvisha Jaloga also 6 types are there. So which are the Savisha Jaloga? Krishna Jaloga, Karbura, Alagarda, Indrayuda, Gochandana, Samudrika. So these are the 6 types of Savisha Jaloga. Nirvisha Jaloga is Kapila, Pingala, Shangumukhi, Mushika, Pundarika Mukhi, Savarika. Okay, so these are the Nirvisha Jaloga. So what is the identical features, like characteristic features of the each Jaloga? Krishna Jaloga is Anjana Sadrishya va Krishna Varni. So it will be looking like Anjana, or otherwise it will be black in color. That is Krishna Jaloga. Karbura is Varmi Machili Sadrishya, Varmi Malsya. In that way, in that shape you will be getting, that is Karbura. Alagarda Roma Yukta. So in Alagarda Jaloga, full the body full that hairs will be there. Indrayudha, it will be looking like Indradhanush. Okay, Indradhanush, in that way, in that shape, if you are getting Jaloga, that is Indrayudha. Then Go Chandana, that will be Go Vrishanavat. Okay, Go Vrishana, in that shape, if you are getting, that is Go Chandana. Okay, then last one is Samudrika. Then Nirvisha Jaloga. So Nirvisha Jaloga, 6 types are there: Kapila, Pingala, Shankhumukhi, Mushika, Pundarika Mukhi, Savarika. So Kapila will be looking like Manashila. Okay, so Manashila color in that way will be there, or Mudga Sadrishya. Okay, Mudga Sadrishya or Manashila. In that way, if you are getting, in that color, if you are getting Jaloga, that is Kapila. Then Pingala is Rektavarni Ashugami. It will be red in color and it will easily movable. That is Pingala. Then Shangamukhi Yakritvarni Shikrapai. Okay, so that is Shikrapai, that is also move very fast, and Yakrit Varna, so it will be color of Yakrit will be there for Shangamukhi. Mushika Anishta Gandhavali, they will be having foul smell in Mushika. Pundarika Mukhi, it will be looking like Mudga Varni. Okay, color of Mudga you can see in Pundarika Mukhi. Savarika is Padma Patra Varni, the lotus leaves are there, no, in that color you will be getting Savarika, and 18 Angula, that is the length of the Savarika. So that Savarika Jaloga, it is used for the animals. Okay, so in 18 Angula in the size, it is used for the animals, Savarika Jaloga. Next one is Dosha Anusara Rekta Lakshana. So if doshas are vitiated in the Rekta, what are the Lakshanas you will be getting? So Vada vitiated, then Rekta will be having Aruna Varna. Okay, so it will be having Aruna Varna will be there. That is called Vadaja Rekta Dushti. So Aruna Varni Va Nahi Jamne Wala. Jamne Wala means it will not clot. Okay, it will not freezing. It will not clot very easily. That is Vadaja Rekta Dushti. Then Pittaja Rekta Dushti Visragandhi. There will be foul smell will be there. Like putrid type of smell will be there. Kafaja Rekta Dushti Gairi Godaka Va Mamsa Peshi Sadrishya. So it will be Kafaja Rekta Dushti, so color will be Gairi Godaka. In that Gairika color will be there, and Mamsa Peshi, it will be looking like a Mamsa Peshi. Sannipadika Rekta Dushti, it will be looking like Kanji Sadrishya. Then Rektaja, like Rekta is getting excessively vitiated, so that time Pitta Sadrishya, the same Pitta Dushti Lakshanas will be there, but it will be in an increased manner will be there. Okay, Pitta Sadrishya Magar Adhiga Kala. Okay, similar to the Pittaja Lakshanas, but excessive dark color you can see in Rekta Dushti. Okay, if Rekta Dhatu is getting vitiated, then like Pittaja Lakshanas will be there, but excessive darkness you can see in the Rekta vitiated condition. Then, due to the improper Karna Vedana, what happened? It will puncture the veins. So, due to the puncture, what happened? You will be getting different Lakshanas that we have already seen. Like if it is affecting in the Kalika Sira, you will be getting Jwara, Daha, Shvayatu, Vedana. In the Marmarika Sira, if it is affecting Jwara, Vedana, Grandhi will be getting. In Lohidika Sira is getting damaging, then Manya, Stamba, Apatanaga, Shirograha, Karna Shura, like Vada Vyadi, you will be getting in Lohidika Sira is getting damaging due to the improper Karna Vedana. Then before doing Karna Vedana, if any doshas are vitiated, to remove the doshas we have to do some procedures. If it is a Vada is vitiated, then Kanji Garma Jalse. So Kanji should be mixed with the hot water, you have to pour in the ear. Okay, in the earlobe, if it is Vada vitiated, then Kanji mixed with the hot water should be poured in the earlobe, so the Vada dosha will get reduces. If it is Pitta is vitiated, then Dugdha plus Shida Jala, like milk and cold water should be mixed together, and you have to do the Sejana. Then Kafaja is vitiated, then Surya Manda mixed with the Ushna Jala. Okay, that should be mixed together, and then you have to do the Sejana in the earlobe area. Okay, so these, like before the Karna Vedana, if these type of doshas are vitiated, then do the Sejana Karma with these liquids. Then Bandha, okay, different type of Bandhas are there. According to Sushruta, 14 Bandha. According to Vakphata, it is 15 Bandhas are there. Okay, so each in where we have to put the Bandha. So first one is Kosha Bandha, that usually used for Anguli Parva, for the fingers. Okay, in the fingers you should put Kosha Bandha. Dama Bandha is indicated in Sambandhanga. Swastika Bandha is you have to put in Sandhi, Kurchaga, Bruise, Tana, Karnatala. So in these areas, if you have got any fracture, dislocation, or if any wound is there, so which Bandha? Swastika Bandha. Sandhi, Kurchaga, Bruise, Tana, Karnatala. Then Anuvelida Bandha is you have to put in Hasta Pada. Okay, Hasta and Pada in these location Anuvelida Bandha. Then Muttoli, that you have to put in Griva and Linga in these areas. Then Mandala is you have to put in Udara, Uru, Bahu. Then Sthagiga Bandha, that you have to put in Angushta, Anguli, Shishanagra. Then Yamaga Bandha, that you have to put in Samyukta Vrana, like excessive vranas are there, then Yamaga Bandha. Then Katwa Bandha, that is you have to put in Hanu Shanga Gandha. Okay, so in these areas you have to put Katwa Bandha. Then China Bandha you have to put in Netra and Apanga area. Then Vibandha is you have to put in Pitha, Udara, Chati. Then Vitana, that you have to put in Sira. Sir, okay, head area, okay, sirpar. Okay, so in the head area you have to do bandaging, then you have to do Vitana Bandha. Then Gofana Bandha is indicated in Todi, Nasa, Oshta, Basti. Okay, Todi means Chibuga, cheek area. Okay, so Chibuga, Nasa, Oshta, Basti, in these areas Gofana Bandha has to be given. Then Panchangi Bandha, that should be given in Jatrutva. Then Utsanga, okay, so that is mentioned by Vakpata. So Bahu, so in that area Utsanga Bandha has to be put. So these are the 15 types of Bandha and which areas you have to put the Bandha. Then times they have mentioned. Okay, so till from the morning till night the times they have mentioned, and each time the time will be representing particular Ridu. Okay, that Ridu Lakshanas you can see. Okay, so the starting is Pratyusha. Okay, Pratyusha. So Pratyusha will be similar to the Hemanda Sadrisha. Pratyusha is sunrise. Okay, sunrise. Okay, rising sun. So that time that the whatever the atmosphere lakshanas are, that is similar to the Hemanda Sadrisha, Hemanda Ridu Sadrisha. Purvana, morning time, that will be looking like Vasanta Ridu Sadrisha. Madhyana, afternoon time, that is Grishma Ridu. Okay, severe hot will be there, and Grishma Ridu also severe hot will be there. Aparana, afternoon, like evening, like 3-4 p.m. that's all we can similar to Pravat Ridu. Then Sandhya, okay, like that evening time 6 p.m. okay, sunset time, so that is looking like a Varsha Ridu. And Ratri, night time, that is looking like a Sharat Ridu. So that lakshanas are there. Okay, in each timing of the day and night, that is representing particular Ridu. Then in the each Ridu, the Vayu will be moving to the particular direction. Okay, so in Hemanda Ridu, Vayu will be moving to the Uttara Disha, and in Vasanta Ridu, it will be moving to the Dakshina. In Grishma Ridu, it will be moving from the Nairudha Disha. Then in Pravit, it is Paschima Disha. Okay, so in each Ridu, the Vayu is moving into different directions, so that they have mentioned here. Then Dosha Pragopa Kala. So Vada Dosha, Pitta Dosha, Kapha Dosha, in which all the timings normally aggravated. Vada Pragopa usually happens in the Pratyusha Kala. Okay, in the early morning. Aparana, okay, in the evening time, in the evening time. Then Jirna Anthe, okay, end of the digestion, Jirna Anthe. Then Gharmande. Gharmande means end of the summer season. Okay, so Pratyusha Kala, early morning, then evening time, that early evening time, then end of the digestion, then end of the summer. So in these timings, usually Vada Pragopa will be there. Then Pitta Pragopa, Madhyana, Ardharatri, Jiryade Anne, Mekhande. Okay, Madhyana, afternoon time, Ardharatri, middle of the night. Okay, Jiryade Anne, the digestion is happening. Okay, during the digestion, then Mekhande. Mekhande means end of the cloud. Okay, end of the cloud. So that time normal Pitta Pragopa will be happening. Kapha Pragopa, Pradosha, Purvana, Bhukta Matre, Basanta. Pradosha means morning time. Okay, morning time usually Kapha Pragopa will be there. Then Purvana. Sorry, Pradosha means dawn. Okay, DAWN, dawn. So pradosha means dawn. In that time, purvana in the morning time, and pukta matre, beginning of the digestion. Okay, beginning of the digestion, then vasanta ritu. So these are the timings where the kapha prakopa usually happens normally. Then Sanjaya Prakopa Prasara, very very important. In Shatkriya Kala, Sanjaya Prakopa Prasara, Vyakta Bheda, Sthana Samsraya, that type of six things are there in Shatkriya Kala. So in that Sanjaya Prakopa Prasara, Sanjaya means dosha is getting accumulating. Prakopa means it is getting aggravating. Prasara means the doshas are started to spreading all over the body. So when the doshas are accumulating, aggravating, whenever it is spreading to all over the body, each lakshanas will be producing. It's very very important. Okay, Vada Sanjaya. If Vada doshas are accumulating, then what are the lakshanas you will be getting? Stabda Purna Koshtada. There will be a stiffness of the abdomen will be there. Like if something is getting filled up and it is getting stiffness. Stabda Purna Koshtada. If it is getting prakopa, it is getting aggravating, Koshta Toda Sanjarana. Pain will be there and you will be getting like Vayu is moving. That type of sound or that feeling you will be getting. Koshta Toda Sanjarana. If Vada is started to aggravating all over the body, then what are the symptoms you will be getting? Vayu Vimarga Gamana Atopa. So there will be opposite flow of the Vayu will be there and Atopa. There will be distension of the abdomen. So these type of lakshanas if you are getting, that is indicating Vada has become started to spreading all over the body. Then Pitta is getting accumulating, Pida Avabhasada, there will be yellowish discoloration and will be there. Manda Ushmadacha Angana, slight increase of fever will be there. Okay, slight increase of temperature you can see if there is Pitta is getting accumulating. Pitta Pragoba, Amlika, Pipasa, Paridaha. So you will be getting Amlika, like a sour taste will be there. Pipasa, thirst will be there. Paridaha, burning sensation. These type of lakshanas are indicating Pitta Pragoba. If Pitta is started to spreading all over the body, so that time Osha, Chosha, Dhumayana, different type of burning sensation you will be getting. So Osha means burning sensation. Okay, burning type of burning sensation. Chosha means you are getting sucking type of pain. Okay, sucking type of pain. Dhumayana is smoky type of, okay, smoking sensation. That type of feeling you will be getting. These are all indicating Pitta has started to spreading all over the body. Then Kapha is getting Kapha Sanjaya Lakshana. Kapha is getting accumulating. So Gauravam Alasya Chaya Karana Vidvesha. So there will be Gaurava, heaviness of the body, Alasya, laziness, then Chaya Karana Vidvesha. What is the reason for getting Kapha accumulation? We will be started to disliking towards that substance. Okay, like a sweet substance if you are taking, so because of that if you are getting Kapha Sanjaya, so you will be having an aversion towards the sweet substance. Okay, Chaya Karana Vidvesha. What is the reason for getting accumulation? So to that we will be feeling some dislike towards the substance. Then Prakopa, Kapha is getting aggravating, then Annadvesha. Okay, there will be aversion towards the food. Hridaya Utkleda, there will be some discomfort will be feeling in the Hridaya Pradesha. Then if it is started to spreading all over the body, so that time Arojaga, Avipaka, Anga Sada, Chardi will be there. So that time Arojaga, anorexia, Avipaka, there will be delay in digestion, Anga Sada, there will be body pain, Chardi, vomiting. So these are all indicating Kapha Prasara Lakshana. So this are very very important. Sanjaya, Prakopa, Prasara lakshanas are always they used to ask in the exam. Then in Vrana Ashrayas we have seen a Vrana Vastu, 8 Vrana Vastus are there. So in the each area Vrana is coming, then what are the discharge you will be getting? Okay, the discharge color and the discharge type. Swatvacha, okay, so in the skin if you are getting Vrana, then the discharge will be looking like Jala Sadrishya or Pida Varna. Okay, yellowish discoloration, the white like a water type of discharge will be getting. Okay, if the Vrana is happening in the skin, Jala Sadrisha Pida Varna Shrava will be getting. In the Mamsa, okay, in the Mamsa if you are getting Vrana, then the discharge will be Grida Sadrishya. Okay, Grida. How the Grida will be looking like, that type of discharge will be there and the color will be Shveda Varna. Okay, Jala Sadrishya Srava Tvak Vrana, Grida Sadrishya Srava Mamsa Vrana. Then Sira, okay, in Sira, blood vessels if you are getting Vrana, okay. So first time, Tatkala Rekta Adi Pravarti. So if you are getting a Vrana in the Sira, immediately you will be getting severe bleeding will be there. So Rekta will be coming out. Kalandara, after some time, like you have got Vrana, then when it become chronic, okay, the Vrana becoming chronic, so that time Osa Sadrishya Srava will be getting. Okay. Then Snayu. In Snayu, if you are getting Vrana, Singhanaka Sadrishya Srava will be there. Okay, Singhanaka means like a nasal discharge is there, no? So that type of Srava, if you are getting, that is indicating Vrana is happened in the Snayu. Okay, then Asti. In Asti Pradesh, if you are getting Vrana, then Asti Samiba Sadrishya, like Asti Samiba, like some bony particles, that type of things you can see in the discharge. Puya Mala Yukta Srava, there will be pus discharge will be there, pus, all those things, like a pus fecal, Mala, okay, that type of things you can see in the discharge. Okay, bony particles will be the pus formation, that's all you can see in the discharge, that is indicating Vrana which has happened in the Asti Pradesha. Then Sandhi, in Sandhi if you are getting Vrana, then Agunjana par Chasni Sadrishya Srava, like Agunjana, whenever you are doing movement, that time you will be getting discharge, and the discharge will be like a syrupy type of discharge, syrup type of discharge if you are getting Chasni. Okay, Chasni Sadrishya means syrup type of discharge you will be getting, and you that always you should understand that whenever you are doing movement, okay, that time only you will be getting discharge. Then Koshta. Okay, in Koshta if you are getting Vrana, then Mutra Purisha Puya Rekta Ki Pravarti. So the discharge will be Mutra Purisha Puya Rekta, all the things mixed together type of discharge you will be getting. Okay, so Jala Sadrishya Srava Tvak, Grida Sadrishya Srava Mamsa, Singhanaka Sadrishya is Nayu. Then during the movement if you are getting discharge, that is Sandhi. Okay, in Sandhi Pradesha you have got Vrana. Next one is Bhasma Kapodasti Varni Vrana. Okay, Bhasma Kapodasti. In that way, in that color Vrana, if you are getting, that is indicating Vataja Vrana. Then Mamsa Pindavat, Ashwapana, Goshringavat. Okay, so this type Mamsa Pinda, like there is a flesh eating is habiting, like in the Vrana, if there is much more this damage of the muscles are happening. Okay, then Go Shringavat. In that way, if you are getting Vrana, these are all indicating Asadhya Vrana, Go Shringavat. Ashwapana. Ashwapana means like it is a lip of a horse. Lip, L-I-P, lips of a horse. In that way, Vrana is there. Mamsa Pinda, in that shape it is there. Go Shringa, in that shape if you are getting Vrana, that's all Asadhya Vrana. Next one is some Vyadi they have mentioned. Okay, for Chedana karma is indicated in which all the Vyadis. Bhagandara, especially Shadaponaka Bhagandara. In that condition, Chedana karma is indicated. Slaishmiga Grindhi, Nadi Vrana, Ashras, Gelashundiga, Valmiga, Upadamsha. In these conditions, Chedana karma is indicated. Bhedana karma is indicated in Visarpa, Vriddhi, Prameha Pedaga, Vrana Shofa, Nadi Vrana, then all kind of Chudra Roga, Talu Pupuda, Tundikeri. In these conditions, Bhedana karma is indicated. Then Lekhana karma is indicated in Rohini, Upajihvika, Adijihvika, Ashras, Mandala, Kushta, Kilasa. Then Eshana karma is indicated in Shalya Yukta Nadi and Unmargi Vrana. Then Vyadhana karma is indicated in Mutra Vriddhi Jalodhara. Then Visravana is indicated in Sannipada, Sannipadaja ke Adirikta Shesha Vidradhyam. So instead of Sannipadaja Vidradi, rest of all the Vidradis you can do Visravana karma. Shlipada Karnapali Roga, Sthana Roga, Talu Kandaka, Krimidanda, Dandaveshta, Upakusha, Shidada. These are the conditions where we can do Visravana karma. Okay. Next one is Marma Khada Lakshana. Okay, so Samanya Lakshana of Marmakhada is Mamsodagabam Rudira Pravarti. So you will be getting bleeding, blood will be coming out, and blood will be looking like a Mamsodaga. Okay, that is indicating there is a damage is happening in the Marma Pradesha. In Sira, if you are getting a damage in the Sira, okay, Sira par Akhada, Surendra Goba Pradima Prabhudam Rektam. Okay, so Indra Goba Pradima, that type of Rekta will be coming, so that is indicating the damage is happened in the Sira. स्नायु पर आघात कौब्ज तीव्र पीड़ा धेर से व्रणक भरना. Okay, kubjada, there will be deformity will be there. If you are getting damage in the tendon, snayu, so there will be slight deformity will be getting, severe pain will be there, and vrana will be healing. It will take little time to heal that vrana, whatever vrana which is happening in the snayu pradesha. Then sandhi par aghata. So in the sandhi pradesh, if you are getting damage or any trauma, it leads to severe pain, tivra ruja. Then asti par aghata, in the bones, if you are getting damaging, khora ruja, yasya nisha dineshu sarva avastasu na shande rasti. Okay, so there will be severe pain, day and night severe pain will be there, and whatever position you are holding, in all the positions you will be getting severe pain. There will be like whatever position, like you don't feel any comfortable in each position. You have to change every time the positions, but you will not be feeling comfortable. So that is indicating there is a damage is happening in the asti pradesha. Mamsa, in Mamsa Pradesh, if you are getting damaging, Sparshana Janati Vipandu Varna. So there will be loss of touch sensation, and there will be Pandu Varna will be there. Okay, so these are the, in each area, whatever damage is happening, these are the Lakshanas you will be getting. Next, some classification of Roga you can see. Vyadhi Bheda, types of Vyadhi. First one is Aupasargika Roga. Pradhama Ulpanna Vyadhi ke Uttara Kalame Ulpanna Vyadhi. That is called Aupasargika Roga. So Aupasargika means the disease that occurs later than the first disease. Okay, disease that occurs later than the first disease, that is called Aupasargika Roga. नेक्स्ट वन इज प्राक केवल रोग. इसमें पूर्व रूप व उपद्रव नहीं होती है. सो इन दिस द रोग विच इज डोंट हैव पूर्व रूप एंड उपद्रव, दैट इज कॉल्ड प्राक केवल रोग. देन अन्य लक्षण रोग, इसमें केवल पूर्व रूप उत्पन्न होता है. सो इन द डिसऑर्डर्स विच शोज ओनली पूर्व रूप, दैट इज कॉल्ड अन्य लक्षण रोग. ओके, सो औपसर्गिका प्राक केवल अन्य लक्षण. सो Aupasargika means the disease which will occur later than the first disease. Okay, like a complication type of. So after the first disease, like later the first disease, you will be getting the second disorder, that is called Aupasargika. Prak Kevala means in this the Vyadhi which is not having Purva Rupa and Upadrava, that is called Prak Kevala. Only Purva Rupa Lakshanas if you are getting, that is Anya Lakshana Roga. Next one is according to Sushruta, some Gana they have mentioned and their functions. Vidari Gandhadi Gana, that is indicated in Pitta Vada Shamaka. Aragvadadi is indicated in Kapha and Vishanashaka, and it is also good for Vrana Shodaka. Varunadi, that is Kapha Meda Nashaka. Okay, and it is also good for Abhyandara Vidradi. Okay, Abhyandara Vidradi Nashaka. Then Veera Tarvadi, that is used for Mutra Kritra, Ashmari, Sharkara Nashaka. For urinary tract disorders, you can use Veera Tarvadi Gana. Then Salasaradi Gana is indicated in Prameha Pandu Nashaka. Rodradi Gana is indicated in Adisara Nashaka. Arkadi Gana is indicated in Krimi Kushta Nashaka. Okay, Krimi. Arka. Ka, in that way you can Arka, Krimi. Okay, due to Krimi you can get skin disorders. Okay, Krimi Kushta Nashaka. Pippalyadi, it is usually given for the digestive disorder, so Amapajaka. Vachadi Haridradi, that is used for Dushta Stanya Shodaka. Then Shyamadi Gana Udavarta Nashaka. Kakolyadi Gana, that is Jeevaniya and Brahmaniya. For that purpose we are using Kakolyadi Gana. Guduchyadi, it is Sarva Jwarahara. Ambashtavadi Pakwa Adisara Nashaka. For the Pakwa Adisara we can give Ambashtavadi Gana. Then Eladi Gana is Vishanashaka. Trapvadi-gana is Sharkara-nashaka, Mushkadi-gana is Sharkara-nashaka, Ushagadi-gana is Ashmari Sharkara Mutra-krachra-nashaka, Amlakyadi-gana Netra-roga-nashaka. Then Surasadi-gana Pradishyaya Kasa Shvasa-nashaka. Okay, so these are the gana and these are the benefit of the each gana. Okay, the rest of the things we'll discuss on the next video.